a young woman comes into the ER with these lesions on her arms, would you know what to do? This is an NCLEX case study. I'm going to give you a presentation, labs, vitals, and assessment, and you're going to guess the diagnosis. And then I'm going to ask you 3 questions about that diagnosis, and there's a bonus question at the end, so don't scroll. This is a 24-year-old African-American woman who presents to the ER with these lesions here. When we asked her some history questions, she's had fatigue for about 3 months. She's had some joint pain and just kind of intermittent here and there fevers. So we decided to go ahead and run some labs on her. And here are the abnormals. Her white blood cell count is 3.1, which is low. Her hemoglobin is 9.8, also low. Creatinine 1.6, which is high, and her UA is positive for protein. When we took a set of vitals, her heart rate's 102, mildly high, blood pressure 152 over 94, which is elevated. Respiratory rate looks good, SpO2 looks good, temperature is 100.6. On assessment, she has bilateral ankle edema. She's got some ulcers in her mouth and her urine is foamy. And you're looking at her and you asked her how long she's had the rash on her face. So she has had this rash for, she said, the last several months. Do you know what this diagnosis is? You've got 3 seconds to answer. 3, 2, 1. This is SLE, or systemic lupus erythematosus. It is otherwise known to most people as lupus. Next question is, what is the most common complication when a patient has lupus? You've got 3 seconds to answer. 3, 2, 1. Lupus nephritis. So this is neph means kidney, itis means inflammation. So we do worry about their kidneys. They sometimes will even need a kidney transplant. Hello, Selena Gomez, right? So we protect the kidneys at all costs, but this is why she's got the protein, foamy urine, and then she's got the protein in her urine. So the kidneys are already starting to be involved. Next question. What lab test do we do to determine that someone has a autoimmune disorder? Doesn't tell us which one, but it tells us that they have one. You've got 3 seconds to answer. 3, 2, 1. That is an ANA. This is not Anna, okay, though that sounds like a lovely name. This is an anti-nuclear antibody, and if it is positive, then we need to do some further investigation to find out which autoimmune disorder that they have. Next question. What do patients with lupus have to avoid at all costs? What are they supposed to avoid? You'll answer in 3, 2, 1. They are supposed to avoid sun exposure and any type of chemicals. This doesn't mean just like bleach. I mean like anything that has any scent in it, laundry detergents, perfumes, anything that has any kind of chemical in it, or if they get exposed to the sun, it will make their symptoms much, much worse. They are supposed to avoid these 2 things. Bonus question. What is this rash called? People know it as a butterfly rash, but what is it actually called? It is very characteristic for lupus. You've got 3 seconds to answer. 3, 2, 1. This one is called a malar rash, otherwise known as butterfly patterned rash. Did you get this case study correct?